Hey guys, welcome back to the channel. Hope you guys are doing good. In this video, we will discuss one of the most common disease nowadays, that is diabetes. So without wasting any more time, let's get started. Let's start with the basic question. What is diabetes? Diabetes occurs when the body is not able to take up sugar into its cells and use it for energy. This results in buildup of extra sugar in the bloodstream. And poorly controlled diabetes can lead to serious consequences, causing damage to a wide range of the body organs and tissues, including the heart, kidneys, eyes, and nerves. You may wonder, why does the blood glucose level rise in diabetes? Let's see why. When you eat carbohydrates like bread, rice or pasta, it is broken down into simpler form, that is the glucose, which occurs during the process of digestion. And when this glucose is present in the bloodstream, it needs help, or in other words a key, to enter into its final destination, that are the cells of the body. The key which helps glucose enter into the cells is insulin. It is a peptide hormone produced by beta cells of pancreas, which we will see later in this video. But for now, let's discuss how does this insulin help glucose enter into the cell. As you already know, there are different type of receptors and channels present in our bodies which helps the cells to function. The same rule is applied for glucose uptake in the cell. Let's use a pictorial method to understand it better. This is the cell, and this green colored area is the glucose channel, which is closed. This is the glucose molecule, and this is the insulin hormone. This is the surface receptor for the insulin present on the same cell. So what happens is, insulin binds with the cell surface receptor, which opens the glucose channel and allows glucose to enter into the cell. When the body doesn't need glucose to be used as energy, it stores it in the muscles and liver in the form of glycogen. Now, let's see what happens if you have diabetes. There are two conditions possible. First, the pancreas doesn't make any insulin or enough insulin. And second, that the pancreas make insulin, but your body's cells don't respond to it and can't use it as it normally should. These two conditions divide diabetes into two types, type 1 diabetes and type 2 diabetes. Let's discuss each of these separately, starting with type 1 diabetes. This type is an autoimmune disease, meaning your body attacks itself. In this case, the insulin producing cells in the pancreas are destroyed. This is a zoomed in view of the pancreas, and these blue shaded areas which you can see are the islets of Langerhans, which contain the beta cells that produce insulin hormone. Type 1 diabetes is usually diagnosed in children and young adults but can develop at any age. People with type 1 diabetes need to take insulin injections every day, and that is why it is also called as insulin dependent diabetes. Second type of diabetes is type 2 diabetes. It is most common type, which usually occurs due to being overweight and inactive lifestyle. In this, the body either doesn't make enough insulin or the body's cells don't respond normally to the insulin. 95% of the people with diabetes have type 2 diabetes. This type is common in middle-aged and elderly people. Other common names of this type are adult onset diabetes and insulin-resistant diabetes. So that is it for this video guys. We will discuss more about diabetes in upcoming videos. Don't forget to subscribe the channel and follow us on Instagram. Links in the description.